Hi, it's Dr. Fred, and I'm coming to you today as the undoctor. And that name was given to me a few years ago by a friend. And what it represents to me is essentially a task that I take on as frequently as possible to undiagnose, unmedicate, and undoctrinate people who are ready for that. Now, if you're diagnosed and you're medicated and you're seeing a doctor and it's working for you, then this is not something that should be of any interest to you. But there are many people out there who are diagnosed and don't feel like the diagnosis fits, who are medicated and don't feel that the medication is helping, and who are receiving treatment that they don't feel is actually moving them forward in their life. And those people need to be at least given a consideration to be undoctored. The idea, again, is being undiagnosed, unmedicated, and undoctrinated. So, you don't need a license to tell somebody or to have a good discussion with somebody that they don't need to pursue something that isn't working. For instance, if someone wants to stop seeing their therapist, or someone wants to stop seeing their coach, or someone wants to stop seeing their doctor, they're fully entitled to do so without a doctor's order. So as a citizen or a friend or a colleague or a caregiver or a caring fellow human, you can certainly have powerful discussions with people who feel that their course of action in taking on their imbalance or their dysfunction with respect to their psychological condition can go a different direction. And you don't need to be licensed to actually consider that. So, one way you might really want to look at that is um, having a discussion about stopping things that don't work can be seen as very friendly and healing in its own self. And that's what I really want you to consider, that it's okay, that it's not outside of your bounds. It's not like you're acting like a doctor without a license. You're acting like a loving friend who is helping people see something that doesn't work for them. And you therefore become a healer, especially if what you're doing is resonating harmonically and connecting with that person at a level that they didn't even know they needed to be connected with. So I'm very familiar with the psychiatric world. I have been immersed in that world for over 3 decades, actually over 4 decades, if you include my time as a child care worker for approximately 8 years before I graduated medical school. And I've really seen how this system doesn't necessarily always add up to the most positive intervention available to help somebody refine themselves or rediscover their balance or recreate a life that works or even relieve themselves of the issues that are bringing them down or leaving them less effective, such as being depressed or anxious or sad or agitated or not finishing tasks or doing poorly in social environments. Or, even sometimes having their thoughts go in different directions or being run by their thoughts or being afraid for the future or afraid or ashamed of recent actions. All of these things are inherently human and we all know what they feel like. And some people are doing them a little more often than other people, perhaps, or at least feeling affected by that. And these people are best served by being heard, by being listened to, by being connected to, by resonating with. And you can also be a healer in that direction. So I invite you to actually get that you too are a healer. And you are a healer as soon as you decide that you're going to help another person. So I invite you to really get that and step into yourself. You are a healer. You, by being a friend, a colleague, a loving human being, someone who cares to move someone else's life forward, can really assist them by directing them in directions that are well within your legal parameters. And even we are counting you on or counting on you to deliver inside of the friendly and collegial and um, um, loving patterns. Thank you very much for listening to this live and for watching this live today. Feel free to leave a comment below. This is the kind of work that I do. I connect people by giving them, I heal people by showing them the route to authentic listening as a means of connecting, and then through that connection, all healing can take place um, as a prerequisite for all healing. Human connection is what's called for. Thank you very much. We'll catch you on the flip side. Bye for now.